Well, hello and welcome to everyone joining us here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm very excited because we're sharing again about one of our upcoming events starting out in the new year on January 18th. So it's right around the corner. Lots of time though to register for this event. You can go to the website right now at goldlearning.com and you can check out all the details. But let me tell you a little bit about this event. It is January 18th, as I mentioned, and this is going to be about pain and assessment management during lactation. So I'm excited to say that this will be a one-day event, and we have three amazing speakers that are going to be speaking with you, including Denise McGinnis, Alison Hazelbaker, and as you can see, one of the stars of the show is going to be with us that day too, Tatiana Kondrashova, and she's going to be here talking about biomechanical techniques for preventing and treating engorgement. Welcome, Tatiana. It's good to have you here today. Thank you for joining us.
Hi, thank you for having me.
Yeah. So, Tatiana, could you please tell everybody that is listening today about where you are in the world? Tell us about where you live, please.
I live in Moscow. It's the capital of Russia. I have two children, two daughters of 33 and 17. I've been a lactation consultant in private practice for almost 15 years. Mm-hmm. And for 7 years, I worked as coordinator of IBCLC exam for Russia.
Wonderful.
Mm-hmm.
And I know you also, you're working as, I see, a project coordinator on a new degree education course for lactation consultants. Can you tell me about this?
Yes, when I started, when I began to work as a lactation consultant, here in Russia, all education for lactation consultants was based on World Health Organization course. It was about 40 hours. And I'm very grateful to my American colleagues who helped us, who opened us new perspectives in our profession, because it was Maya Bolman who first came to Russia, and she told us about existing of IBCLC exam, about conferences and magazines on human lactation. We didn't know anything about it. And Teresa Yarashevich, IBCLC from USA, in one of ILCA conferences, she asked lactation consultants to donate some books for Russian colleagues, and she arranged discussion and vote for which books are the best.
Ah, wonderful.
Yeah, and they bought it in a conference store. And Teresa brought those books to Moscow. We organized a lactation library, and we organized lactation English course for ourselves. And a year later, we passed the exam, 11 of Russian lactation consultants and doctors, and we were the first IBCLC in Russia.
Wow, that's amazing. Yes. How many lactation consultants or IBCLCs do you have now in Russia?
I'm not sure, because many of us haven't passed the exam again.
Okay. Okay. And
They
do you
don't want
think,
certification
yeah,
because it's expensive for us.
yeah, absolutely. Absolutely. But you continue, so you continue to work together. And you work in private practice, but do you have other people that you know that you can work with as well? Like, do you have other friends
I
or
work in
colleagues?
private practice, but we have a little rest after this exam, and then each of us took several topics from which we studied to prepare for the exam,
Mhm,
and we made a course. It was almost for free for other lactation consultants,
mhm,
online refreshing course.
mhm,
And it exists, it still exists, it's new
mhm.
degree. And now I can say that the average level of education of Russian lactation consultants is like the common education level of other IBCLCs in the whole world.
Oh, good. That's wonderful. That's fantastic. Okay,
Mm.
let's would like to ask you about your presentation that you're presenting on. And again, the title of the presentation is the Biomechanical Techniques for Preventing and Treating Engorgement. Tell me why you want to share about this topic, Tatiana.
Because it have changed my practice. Um, I can take my experience and skills and questions from lactation consulting and try to apply those to the science of motion, the mechanic of motion.
Mm,
Um, my practice has been enhanced with this because now I can look at latching problems more analytically with more complex approach.
mhm. Yes, and I know we were talking about looking at the mothers, the parents, and you said that often they use their instincts in some of the positioning that they have with their babies. And I wondered if this is a question that you would relate to, that sometimes I find that we, as lactation consultants or healthcare workers, that we would actually take away or we would change that for the mother, even though it's the most comfortable and it's working. Do you find that sometimes this happens too, that you see other people change too many things, whereas it is actually working for the mother as well with her own instincts?
Um, I don't think it all based on instincts. It mostly cultural things.
Ah,
Uh,
yes.
yes, and you know the idea to teach mothers to breastfeeding it date back to the early 20th century,
Right.
right when governments were concerned about raising infant mortality.
Right. Yeah.
Due to industrial revolution and doctors were concerned also,
Mm-hmm.
and they saw their mission in educating parents about breastfeeding. Though I think that the best way to support breastfeeding is paid maternity leave. Yeah.
With extra, with
Mhm.
extended leave after birth.
Yeah, and however, in the 20th century, in the early 20th century, hundreds of medical books were published with pictures, illustrations of right breastfeeding positioning.
Mm-hmm.
But the problem is that all these books were written by doctors. And we know that doctors at that time, they all were male, white, wealthy gentlemen, and probably they didn't even saw their own kids nursing.
Right. So it was very analytical, very research based, and not practical or clinical, and based on perhaps what a parent or a woman would feel when she was actually holding her baby.
Yes, and it's medicalized approach.
Mm-hmm.
And it's a pity that lactation consultants, most of them, they took this approach. And still exists two ideas of how to teach mothers, and how ideas about what is the good, how is the good latch should look
Mm-hmm.
like.
Mm-hmm.
The medicalized one, and natural and beautiful one that was evolved with generations of mothers.
That's wonderful. Yes. So I think what I'm hearing you say is that we need to listen to the mothers and understand what their needs are so that we can,
look to other mothers.
yeah, and approach it from there. That's wonderful. Well,
You can describe what are they doing
yeah, they can describe it. Well,
in the terms of biomechanics.
Yeah, that's wonderful. So I've already had a chance to see and hear you talk a little bit about your presentation, and it looks spectacular, I have to say. I'm really looking forward to you sharing it with our audience. I know folks are going to be asking questions and learning with you in terms of what you're showing. So that's going to be wonderful. So I invite everybody who is listening right now to come and join us for that day of learning. It's going to be on January 18th. Thank you so much, Tatiana, for being with me here today.
Thank you for having me.
Yeah. Yeah, you can check out all the details online at goldlearning.com. That will give you all the information on each of the topics. Abstracts and bios, of course, are online now. You'll be able to register for this event and see all of the other events that are coming up for the new year. Thank you so much for joining us here today, and have a wonderful rest of your day. Bye-bye for now, everyone.